If you're a runner who's experiencing back pain whilst you're running, then I'm going to share with you some practical strategies, give you a better understanding and give you some ideas of how to get better. My name's Ed. I've been a physio for 12 years. I've got a physio clinic in Southwest London, specializing in treating running injuries. And I've seen lots of people with back pain who've come in and they've struggled with getting back into running, or the running itself has caused back pain. And there's some really key things to think about when we're treating this type of injury. Back pain is a very, very complex condition to begin with. Back pain is influenced by lots of different factors, and also lots of those factors are not physical. Lots of people think, if I just have a strong core, if I just have better posture, if I just do these back stretches or start Pilates, I'll be fine. But actually, when we look at the research about back pain and what types of things influence the symptoms that you feel, we've got stress, we've got sleep, emotional health, work stress, relationships, and the list is endless. So there are lots of non-physical things that can influence your back, how sensitive it feels. So it's important to understand that complexity and not just simplify something as complex as back pain. But when we're thinking about the physical side of back pain, what I tend to see in the treatment room and on the treadmill when I'm doing a running assessment, if someone has back pain, is they have a very low cadence, they have a huge overstride. So their foot lands way ahead of their center of mass when they run. What that does is puts you in a position where the back muscles are going to start to do more of the work. And obviously that means more of the load goes into your back. Second thing I see a lot of is people running too fast. It sounds silly, but there's so many runners that I meet who think that unless I'm absolutely gasping for breath, then it's just not worth running. I said to someone recently, have you ever tried zone 2 running? And they said, oh, you mean like a brisk walk? In a lot of people's minds, they think that if you're not absolutely at the end of your limit when you're running, it's just not worth doing. So what I do tend to see is people running too fast. That encourages the overstride, and then the load into your back and that cumulative amount of force over a period of weeks just starts to become a real problem for your back. Sometimes just a sensible solution to begin with is just running slower for 3 or 4 of your runs a week. Everyone's heard of the 80-20 rule. 80% of the week should be low and slow. So we're talking 5 out of 10 on the effort scale, should be able to talk, and we just want miles in the legs. Obviously this is long distance running, not kind of sprinting and things like that, probably arguably middle distance as well. By using that strategy, what we see is fresher legs for the harder runs. So it means that you kind of run potentially more efficiently, you can tolerate those more tougher runs because you haven't just been continuously working at the top end. It also means that generally if you're running a bit slower, you're also going to reduce that overstride a little bit as well. I remember when I was dealing with an injury and I did 5Ks, very, very, very slow pace in 5 days. So sometimes a strategy that people just need to use is just running much, much, much slower if you've got any kind of pains that you're experiencing whilst the injury is settling down, and then kind of gradually build it back up. And runners often need to understand that you need variety, particularly when we're thinking about the cardiovascular system. We need to expose the heart and the body and the legs to really intense running. But we also need to expose it to those longer periods of kind of that more zone 2 pace just to get the miles in the legs as well. Now, the other thing to think about when we're talking about back pain in runners is the back pain may have started and it may not even be related to running. So you may have had a back injury, you may have just been sat at your desk for too long, or you feel like you've just been neglecting your body a bit and not been moving and exercising very much, which has just led to your back getting really, really stiff. Or maybe you've just woken up one day and your back has just really flared up and you don't really know why. It's incredibly difficult to move, to bend. You feel like you've aged about 30 years. Let's say the problem is settling down. With time, the injury that's happened, often if it's maybe some sort of disc bulge, then your body will be working really hard to heal that disc bulge, to reabsorb it. But during that process, we're going to have inflammation, and that's what we need to get better, and that's what we need your body to use to reabsorb the disc and re-heal the tissue and to heal the tissue. But the downside is it makes you feel very stiff when you wake up. It's quite painful. It's going to make daily life quite difficult with sitting, bending, coughing and sneezing, lots of other tasks like putting your socks on as well. But let's say we're moving through that stage, we're starting to feel a bit better, we're using some exercises to kind of feel more mobile, and now we're kind of at the stage where pain is at a level where it feels that we could start to do some running. The worst thing you could do is just go back to your normal routine of running, normal intensity, normal times that you would normally be getting. Even if you've had a week off running or 2, the amount, the sort of low tolerance and how much your body can tolerate will have dropped during that time. Plus, we've also probably still got a healing process going on with your back, that would be the worst thing you could do. What we recommend instead is doing a bit of a mixture of run walking to begin with. Then we might go to 5-minute continuous run, then we might go to 15, then 30. And this is all at a really, really slow pace where, again, you're just getting the miles in your legs. We're not worried about the time, the distance that you're doing, and we're not thinking about the intensity. And once we pass those different milestones, then we might just slowly increase, get yourself back to that normal amount of running that you were doing before. In terms of physical problems that I tend to see, what I tend to see is lower abdominals, so the kind of lower tummy muscles. We tend to see that their endurance isn't very good. So there's a certain amount of lumbar extension that happens, which is your back kind of arching as you run, and your lower abdominals are the muscles that control that area. So what we need is lots of endurance, and there'll be lots of work that we would do there to help our patients kind of maintain and increase that after they've either recovered from a back injury or had a back injury from running. Cadence is definitely something that I would be looking to address. So I'd be increasing someone's cadence if they're coming in with back pain a lot of the time. I'd also be using lots of plyometrics, lots of running drills to get the quality of how they're running a lot better as well, and get them tolerating different planes of movement and tolerating plyometric movements as well. If someone wants to get back to doing faster running, so intervals or sprinting, a lot of the time it's working on the knee drive. So we're going to be working on driving the knee a lot higher, because that's going to help reduce the overstride. Now, remember what we talked about. The overstride is where the foot lands ahead of the center of mass, which increases the pressure in your back. If the knee drives up nice and high, the foot then tends to land more underneath the center of mass. So the calf, the hamstring, the hip muscles can do more of the work rather than your back muscles. So there's some of the things that I would be looking to address. As you can imagine, every back patient that we see is very different, and there's all sorts of other factors that we would be looking at to address as well. If you like this video, check out the rest of my videos on my YouTube channel. There's so many more videos on how to keep healthy as a runner. I look forward to seeing you again on the next video.